We sat down with Adrian Treverton, CEO at Extrol, and asked him how radiation treatment benefited non-melanoma skin cancer patients during COVID.
COVID had a massive impact on the treatment of non-melanoma skin cancer over the last year. Most of the people who are going to be vulnerable from COVID are the same people who are likely to develop non-melanoma skin cancer. Because generally you develop non-melanoma skin cancer when you're in your later years of life, 50, 60, 70, 80. That's when you're likely to get a basal cell carcinoma or squamous cell carcinoma. And they're the exact groups that are very, very vulnerable from the COVID pandemic. But the nice thing is about radiation therapy is compared to surgery, you're going to have to go to the doctor's practice, you're going to have to be there for the day. Whereas radiation therapy, what a lot of the practices did was they adapted. They had their patients get treatment on the machine they need. They only interact with the radiation therapist and the doctor. They're not in the waiting room, they're not around other people, and they can go in and out quite quickly. And for the vulnerable and people who are concerned about COVID, this is an excellent way of getting treatment without that cancer getting to the point where it's really going to be something that's going to be difficult to deal with in 3 to 6 months if you're going to wait for the pandemic to come over. So radiation therapy, in fact, has been kind of a lifeline for people who have non-melanoma skin cancer because they don't have to have surgery and don't have to take these risks of being infected with COVID. They can actually get treatment in a lower risk environment than the alternative.